Hi, my name's Claire. I'm your student nurse today. Can you tell me what your name is?
I'm Clare.
Perfect. Okay, can I see your wristband? Okay, what's your date of birth
10/1/2000.
and your last name?
Salyer.
Perfect. Okay, and how old are you?
I'm 20.
20, and you're a Caucasian female. How are you feeling today?
I'm feeling very well.
Okay.
Just here for like a physical.
Great. Okay, and you seem very healthy. Seems like you have good dress, grooming, you take care of yourself well and hygiene. Your general demeanor seems good, and your affect seems good. Thought pattern is logical. What did you eat for breakfast this morning?
I had yogurt and granola.
Okay, and what state were you born in?
I was born in Indiana.
Do you know the city?
Michigan City.
Great. And if I told you an apple a day keeps the doctor away, what do you think that would mean?
Just means like having a healthy diet and exercise will decrease your risks of going to the hospital.
Good. Okay. And how tall are you?
5'6".
Okay, and you how much do you weigh?
About 120.
Great. So that would put you at a BMI around 19, which is really healthy. Okay, so I'm going to take your vital signs if that's okay.
Yeah.
Okay, great. So I can grab your pulse. I'm just going to take your radial pulse.
Okay.
Perfect. So I got 60 for your pulse, and I got 18 for respiration, so that's good. And if I could, I'm just going to take your temperature. Okay, this goes in your ear.
Yes.
Okay, so that is 98.4, which is great. And I'm going to take your blood pressure now. Okay. Put this cuff around your arm. Okay, 2 fingers in there. This right here. Okay, so I'm just going to feel your pulse and pump it up really quick.
Okay.
Okay, now I'm going to listen. My stethoscope. Okay, great. So I got 110/70, which is a really healthy blood pressure. And that's it. We'll do a respiratory assessment on you. Okay, so I'm just gonna feel right here, your clavicles, your skin feels warm, the moisture is normal, and then I'm just gonna pinch right here to see the turgor, and that was really good. Your texture is also good, you don't have any lesions that I see. Okay, so then we're going to do the thorax, and the size, shape, and symmetry seem to be normal. I'm going to see if you can shrug for me. Good, that's good. I don't see any retractions, so that's good. Okay, now I'm just going to feel your clavicles, they're even, they feel good. I'm gonna go down your sternum.
Okay.
Make sure that all feels normal. Good, to your lungs. Breathe normal, just deep breaths, but no quicker than normal.
Okay.
Okay, that sounded good.
Okay.
Okay, so I heard vesicular breath sounds all the way through, so that's good. If it's okay, I'm gonna put my hands under your chest right here, and if you could take a deep breath for me. Good, okay, that was good expansion. Okay, so then just on inspecting the lateral side, it looks like your color's normal and there's no lesions. And then I'm gonna look at the back of your, great, okay. Okay, so just upon inspecting, it looks like the color is normal as well. There's no lesions present. Your scapulas feel normal. I can just feel your spine. It's normal as well. The diameter looks normal. Okay. And then I'm gonna listen. And just take deep breaths, but no quicker than normal. And if you could wrap your arms
Okay.
around your chest. Okay, so I heard vesicular breath sounds all the way through, which is good. And I'm just gonna put my hands back here as well. If you could take a deep breath for me. Great. Okay. Okay, so your rate was normal. It was consistent with your vital signs. The rhythm was regular. The depth was deep. It was non-labored. I didn't hear any adventitious breath sounds. There was no use of accessory muscles. And yeah, it all sounded good.
Good.
Okay, so I'm going to be performing a cardiac assessment on you today.
Okay.
If you don't mind laying down for me with your head on the pillow. Okay, and first I'm just going to inspect to make sure there's no heaves or lifts. And I'm not seeing any heaves or lifts in your intercostal spaces or in your epigastric area, so that's great. Okay, I'm going to palpate and make sure there's no pulsations or thrills. No pulsations, no thrills. 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 And down here there's a slight tapping, but no thrills, which is good. So I'm going to listen to your heart now. And if you could take a deep breath and hold it for me.
Okay.
Okay, I'm going to listen one more time. Okay, so I didn't hear any extra high sounds, which is good. I'm going to flip it over to the bell and hear your low sounds of your heart. And I didn't hear any extra low sounds either, which is great. There was an appropriate relationship between your S1 and S2 sounds. The rate was consistent with your vital signs. The rhythm was regular. The strength was strong, and I didn't hear any extra heart sounds as well, which is great.
Okay.
And then I'm going to percuss across your precordium. Okay, great. So I felt resonance here, and then in between it was dull.
Mm-hmm.
So yeah, so everything looked great and sounded great. Thank you.